Hello, everyone. How are you today? I'm Dr. Tammy, and we are going to continue our discussion and practice um, of how to reduce anxiety and panic. Now, I must, as I've said in my previous videos, I must put this out there that this is not therapy, even though I'm a clinical psychologist and a marriage and family therapist. This does not take the place of therapy, and I'm not providing therapy at this time. What I am doing is providing you some coaching and some tools and how you can implement very simple strategies to decrease your anxiety, um, whether you have extreme anxiety, moderate, or minimal anxiety. In our world today, of course, many of us have developed anxiety, and that anxiety can grow and it can become very problematic and interfere with our daily functioning. It can also lead to other problems and other mental health situations like depression and avoidance and things like that. So, um, I would invite you right now just to take a few minutes. This is going to be very short. I've tried to keep the exercises shorter as I walk you through them to help you. But you can see I have a candle going here that has a nice fragrance. It's actually called Falling Leaves, so it has a very nice, pleasant aroma. So if you have a candle or something you want to light and just get more of a calm feeling there wherever you're at. Hopefully, my pups will be quiet. I have three, not puppies. I call them pups, but they're full grown. But anyway, so they've already eaten, and I think they're going to be settled down for me. Now, I encourage you to go back. This is part three. I encourage you to go back if you haven't watched part one, Managing Anxiety. Part one, I believe it's about 28 minutes. I know it's a little bit longer, but it's very important that you watch that one because it lays a foundation and is going to help you understand how anxiety operates when it starts affecting our bodies and why it's so uncomfortable and why it can become so problematic. I don't want to rehash and go back and share that, but I do encourage you to go back, watch that one so you can understand when I'm referring to the sympathetic nervous system and how we are working to really calm that down and teaching strategies in how to make that happen. It is absolutely possible to to get our sympathetic nervous system to calm down and kick over into the parasympathetic nervous system, because that's what ends up really bothering us and becoming problematic is not the anxiety itself or the memories or the thoughts or the environment. It's actually what's happening within the nervous system on a physiological level. Okay, so go back and watch that, and then if you haven't seen Managing Anxiety Part 2, doing the exercises, I encourage you to do that as well, because that that one that we just did yesterday or day before is teaching one of the first skills, which is grounding. Now, I want you to learn the grounding exercises and how to do that before going on to do this one. So this today, we are going to talk about what we call resourcing. And I'm going to teach you about this. And then I'm going to walk you through. So that's why I have the candle going. I encourage you to have a candle and just a quiet spot where you can be, there hopefully by yourself, or maybe you have someone that you would like to do this with, your loved one or a family member or your child or your dogs that um, anyway, okay, so going back to that nervous system, the autonomic nervous system, which we said has two branches, right? Autonomic meaning automatic. Autonomic nervous system has a sympathetic, which leads to our fight or flight or freeze. And then the parasympathetic is the one where we're totally chill or relaxed, heart rate is down, we feel calm. Okay. So when you experience anxiety, and you have certain thoughts, and it always starts with thoughts. It always starts with a thought. And whether that is you're out in a crowded place, this even happened to me many years ago when I was at Disneyland. We were there for my birthday, which was right after Christmas, and it was packed. The park was packed, and my husband and I got into a situation where it just was like this vortex. I mean, it was like you couldn't get out. It was horrible. And people were pressing in, and I felt all of a sudden this panic come over me because my thoughts were, I'm trapped and I can't get out. And what if people start panicking? There's a stampede. So it starts in our thoughts. So those thoughts then lead to a response in our body. That response is the autonomic nervous system, the sympathetic, which causes us, it's there intentionally by God to create a response. So if we're in a dangerous situation, as I previously shared, that response is going to save our life for us to get out of there, either run or fight. Now, if you've experienced trauma and you had trauma as a child, you are also possibly going to experience the third part of that, either um, the fight or the flight or the freeze. Freezing is where you are panicked, overcome with panic, but you can't do anything. It's almost like your body is just frozen. This happens, like I said, with people who have had abuse in childhood, traumas. Even it can happen as you're a grown person, and you have trauma, and you can also have that experience as well, where you freeze. Okay, so our physiological response in our body is what really causes us the problem, as we said last time. And in part two, you learned how to ground yourself. Because here's the truth. And this is where this secret comes in, and the powerfulness of these techniques and why they are so effective. It's because your thoughts that are leading to this response in your body, those can't compete when you are placing your thoughts on your body and a response in your body. And instead of the response being panic and what's going to happen, you purposefully put your focus on your body. So in the grounding, I had you, have yourself feel a part of your body with your eyes closed and get in touch with that part of your body. Okay, so building on that, now is the resourcing. Now, again, it's not enough to just stop thoughts. I've had so many people ask me over the years, Dr. Tammy, how do I stop negative thoughts? How do I stop thinking this way when I'm out there or anywhere, and I'm having these anxious thoughts, panicked, or some negative thoughts that lead to all sorts of problems? Well, we get in touch with the body because the body and the mind are connected. You have a thought and you have a response, right? So instead of having the negative thoughts and the scary thoughts, and even as illogical as they may be or irrational, nonetheless, those thoughts are going to affect your body. So we're taking and putting our thoughts in a positive place on our body. So in resourcing, I want you to think about a very happy memory. Okay, I'm going to give you a couple moments here. And I want you to think about it. It can be a place you went to, it could be a certain time, but it has to be something very specific and tangible, something that is very real to you. Okay. So I want you to close your eyes now. Go ahead and just close your eyes. And if you feel safe in your environment and all of that, just in the quietness of where you're at, close your eyes. Now, as your eyes are closed, I want you to think and bring up to your mind that very happy memory. It could be when you got a new puppy, it could be when you met your best friend, it could be a family vacation, it could be a graduation. So I want you to come up with that. Okay, now hold on to that. Keep your eyes closed. Now I want you to picture that happy memory. I want you to go there. I want you to revisit and go there right now. I want you to see the details. What was the weather like? Can you smell anything? Get in touch with as many of the senses as you can in this memory. Take it in. See the details. Now I want you to notice how you're feeling right now. Any sounds? What do you hear? Connected to this very happy place, this very happy memory. Take that in. And I want you to notice how your body's feeling. I want you to notice, where do you feel good? Is it in your chest? Your stomach? All over your body? I want you to notice how your body is feeling right now. Just notice that and stay there. Very good. You are in the parasympathetic place within your nervous system now. Okay, you can open your eyes. Now that was very short, and in our next video, we are going to, in part 4, I'm going to take you into the grounding exercise. We're going to ground, and then we're going to do this resourcing. It's so powerful, yet so simple. And the secret is that the thoughts can't compete. So when you put a thought on this place, this happy place, when you put your thought there and you really get in touch with it in detail, and you go back to that place and you're re-experiencing that, your physiological response is going to be in the parasympathetic, which is that part of the nervous system, that part of the autonomic nervous system that calms down. So you can go from heightened high level of anxiety and upset and panic, and you can use these exercises and you can train your physiological response to shift into that parasympathetic. It takes practice, like riding a bike. We didn't learn overnight, right? Well, if you are used to being in a heightened level with your nervous system, if you are used to being in that place of always feeling up, and I like to compare it, like if you remember when we were in elementary school and we were learning how to print, well, many of us, I don't know about the younger kids today, but you were given this lined paper and you had these wide lines. Okay, so kind of, picture that. Or even like an EKG where you see, okay. So picture this bar here. Your nervous system, healthy, normal, calm, is within that perimeter. But the moment you start shooting up above that perimeter, that's heightened nervous system. That's heightened our autonomic nervous system. Our sympathetic nervous system is kicked in, and that causes everything to go up. And as we said in our first um, part one, we talked about how the cortisol levels that flood, the brain, the body, and how that's helpful in the moment to get us to respond, but ongoing elevated levels of cortisol in the body is damaging and leads to all sorts of problems. And not to mention the cell damage and so much happening within our bodies when we are living in a place outside of that zone, way up there. So we want to train our bodies to come back down to that place. It is phenomenal. I have actually worked with so many patients over the years and clients who literally have turned their life around and been able to go into a place of um, not experiencing that elevated anxiety everywhere they go. So that's all I have for you today. I'm trying to keep these short. So if you like what you're seeing, if this is helpful for you, please click subscribe. Please subscribe to my YouTube channel because I'm going to do more of these. And if you would also share it on your Instagram, Facebook, whatever, or with your friends. And it would be great to have you subscribe because then I know that that it's helpful and that people are interested and that it's helpful for people. And it also will help you get notifications of when I'm doing these. Okay. So take care. Have a wonderful rest of your day. And I will see you for part 4.